Hello, I'm Xuefei Chen Axelsson from Greenpost. I'm in the Nobel Forum, and we just had a press conference about this year's Nobel Prize in Medicine, and Chinese Tu Youyou won the prize. So here we have the expert to explain this. So can you tell us, why Tu Youyou won this year's Nobel Prize?
So Tu Youyou got half of this year's Nobel Prize for her discovery of artemisinin, and she did that from an herb. So she was the one who identified that artemisinin under herb, the Chinese artemisinin branch, contains a compound artemisinin that actually has the best effect against malaria parasite that has ever been found. So she discovered a way to elute out the active compound from the herb. And she also discovered how to elute away the toxic compartment from the herb, so that actually it could be developed a safe and very efficacy drug, artemisinin, for the treatment of severe malaria.
Mm-hmm. And how do you comment the contribution of this discovery or the importance of
So
this discovery?
her component to identify how to elute out the biological activity, what type of compound that was, how to purify it, and then make crystals and identification of molecular formulation for that. She set the stage for this whole development. It was a team effort, but she did the paradigm shift, the shift that opened the doors for other scientists to go about, to contribute to the further development. She went in this process, which was a national process, when there was some success, but there were also failures, and there was a wonder which way to go. There was a part of the project that said, look for all different types of traditional Chinese medicine to see whether you can find something there. And she went in then with knowledge in chemistry and pharmacy, in how to elute out things, and how to isolate things, and how to test them for biological activity. And there she was the really paradigm shifter. She made the change to our knowledge. Then after she had identified that this was a biological active compound and it was safe and got rid of its toxicity, then there were a lot of other groups in China who took this further on to try it in different animal models, and then to try it in more human infected with malaria. And then eventually it was companies that took on large-scale production. But there is always one who has to lead, and we were very happy when we saw who that was, and we could identify it down to Tu Youyou and specific moments in her career when she did it.
Mm-hmm. And can we say that even without this medicine, we would have millions people lose their lives?
Yes, we can say that, because there were clinical trials done later on with the pure substance, artemisinin, the pure substance, and that was tested against conventional quinine, mefloquine, and it was demonstrated a significant reduced mortality in severe malaria. 35% reduced mortality in children below the age of 5 with severe malaria. So we can then say at least 100,000 lives are saved every year by that. And we can also say that the total morbidity, illness, goes down because there's a completely new mechanistic action, so that artemisinin involves much earlier on in the life cycle.
Is it like a vaccination?
No, you cannot say it's a
So
vaccination.
it's just a cure.
So it's a cure. And we do not use it for prevention. We keep it for the cure of the infected, ill people.
Maybe just very briefly talk about the other half of the prize.
Yes. So the other half goes to scientist in Japan, Satoshi Omura, and then his collaborator in United States, William Campbell. Together, they collectively discovered a new compound for treatment of round-worm infections, called them in Latin nematode infections. They infect a third of the human population and generate chronic worm infections. There are two examples of that are quite well known: river blindness and elephantiasis. Those affect 25 million who get river blindness infection, and then there are 120 million who have elephantiasis infection. These are called filaria infections. And they discovered the compound that by a single yearly dose cure, if you repeat in a number of years, because it kills the microfilaria, the small children of the adult filaria are killed off extremely efficient with a single dose effect for 12 months.
And this disease mostly is in Africa?
These are predominantly affecting Africa, but there are also in Americas and Southeast Asia nations like Yemen, for instance, that has problems with that. Predominantly, it's sub-Saharan Africa that has the greatest number. River blindness is 31 nations, and elephantiasis is 81 nations that are affected by this type of where it is endemic and risk of people becoming infected.
And Mr. Campbell, is he the Irish? He's from Ireland, or he's American?
Yeah.
Or
so
double?
Campbell is born and raised in Ireland, but he did all his science in the United States.
And he is still in the United States?
Yes, he's still in the United States, in Drew University in New Jersey, in the United States. So he's now a professor emeritus at that university. So it was really a collaboration between Tokyo and between New Jersey, and in that sense he was at that time working at a pharmaceutical company called Merck. So there was a collaboration. So Omura screened bacterial cultures. He screened in fact 45,000 different bacteria, and then he selected 50 that he gave to Campbell. And Campbell then had specific means of losing out biological activity against numbers of different microbes. And he discovered the effect against element infections in different animal settings.
Thank you very much.
Best of luck, and thank you for coming and listening to us.